Ever since the pandemic, it seems like public health and the healthcare industry as a whole has been top of mind for many Americans. And while we often see criticisms, sometimes warranted, sometimes not, Wilgina Jackson Glover says this community involvement is overall a good thing for progress.
I think it's healthy for consumers to question digital health technologies that come onto the market. I think it is just a reflection of patients advocating for themselves. We often talk about the importance of patient voice, patient experience, and patients being able to say what they would like or not like as a part of their healthcare.
Glover is a Clutchin Foundation Distinguished Professor of Global Healthcare Entrepreneurship at Babson College. She says the one thing consumers should take comfort in is that the industry is moving toward patient-driven entrepreneurship. This practice puts the patient experience at the center of what companies are wanting to achieve, instead of simply creating a product to make a quick buck.
Ultimately, the new digital health app or new service, new pharmacological solution, the new device that comes out is really coming out with the patient at the center of the development process. We often talk about the importance of patients being involved in co-creating solutions, so that even early in the process, you can actually have patients and patient advocates be a part of the process even in the earlier stages of development, so that once something does come to market, it isn't brand new for those advocacy communities, but that they're well aware and excited for the innovations to come to market.
Healthcare companies want to create a service or product that people will use. So with more and more consumers putting in time to research which invention they deem worthy enough to buy, the manufacturer's goals need to match the needs of the consumers. Ron Gutman, a health tech entrepreneur and inventor, says this principle is now more important than ever. Though it sounds simple, one look at America's healthcare industry shows that it may not be as easy to put into practice. There are a lot of great ideas that either don't get executed well or don't make it to market at all. Glover says that in researching healthcare entrepreneurs, she's noticed a few factors that often influence success. The first one is the ability to create a high-value team.
So healthcare has both the practice side, the clinical side, but also the business side. And so we often find that some of the most successful companies, when they begin, have an individual that knows the business and an individual that knows the clinical care side of the equation. And so by starting that way, you can carry both values forward as you continue to do the work.
The second aspect is how often these entrepreneurs are updating their knowledge and research in their given area.
So not sort of resting on where they started, but continuing to build that evidence base out as they continue their business, and doing it ethically is also very important. And then ultimately that should achieve health outcomes that we can measure, that we know that we're achieving what we would like to achieve for our patients, and also the financial outcomes to make sure that the business is solvent over time.
Because healthcare deals so closely with some of the most vulnerable parts of people, it can't always operate like other industries. Gutman says that this human aspect is what makes the field so unique. Not only are businesses trying to find solutions, but they also have to take the patient's feelings into account and create something that's providing a positive experience, as well as a good outcome.
I think that healthcare can be complicated, and it's because it involves the most important thing in the world is the human element, right? So, and I think that the human element is not simple, it's not linear, it's not a machine, right? So, and I think that when you involve human beings, there are multiple facets to a solution. And I think that when product people, when business people are trying to build solutions in healthcare, they need to take into account their real needs. And the needs are not just solving, a particular condition or providing a remedy or creating a temporary stop to a pain, but it's really thinking about the person holistically. And in order to create solutions that are sustainable and really, really help people, you need to really create solutions that are artisan, meaning that they pay attention to detail, they pay attention to the whole individual and not just to the small thing that you're trying to solve for. And they are very, very intricate.
To Gutman, the goal is to help people stay not only healthy, but happy, and to keep them feeling like this well into the future. One of his own healthcare tech companies called Intrivo aims to follow these values by being a sort of one-stop shop for consumers who need COVID testing. He noticed that there were a lot of options for people to get tested or treatments or access to more information, but the issue Gutman found was that they were all individual solutions.
Some people created a test, some people created a vaccine, some people created a medication, some doctors provided consultation and this and that. And we were the first ones to really put it all together in a holistic solution that took care of all the way from understanding what you have and if you have something, to getting the right kind of education of what would be the best solution for you, to provide the testing to validate that things actually are the way you think they are or you feel they are, taking the data and moving it to the right kind of like healthcare professional seamlessly to really evaluate it and help really give the right diagnosis, provide that diagnosis, even when necessary, provide a prescription for the right kind of treatment. Not only that, by then also deliver the prescription to the individual and then help them adhere to it for the longest term.
Having all of this accessible through one website is an example of the holistic solutions Gutmann feels should be at the forefront of health entrepreneurship. And since what works in other industries doesn't always translate to success in healthcare, does the same principle apply to its leaders? Many people used to assume that this industry requires a specific type of person. However, Glover says that research shows there's no one who's born with the innate ability to be successful in healthcare. Instead, prosperous ventures come from specific skills that anyone can develop over time.
We think about how can an individual become more adept at adjusting and adapting to change, adapting to the volatility of a market, adapting to complexity. And so I think has been true in the general entrepreneurship literature and becomes even more so important, I think, in healthcare. It is by definition, as one of my colleagues, Jay Rao, often says, it is a volatile, uncertain, complex, and adaptive system. And so because of those challenges, we know that those are skills that individuals can develop. We aren't necessarily born with those capabilities innately. Some may have some strengths, but there are things that we need to actively develop over time.
Building entrepreneurial skills is one thing, but as someone who's successfully been in the industry for years, Gutmann believes that there is a foundational trait all people in the healthcare industry should possess: empathy. He believes that deeply caring is what sets healthcare apart from other areas of business.
In other businesses, you may be able to just create solutions, but if you don't deeply care about the individuals, healthcare has two words in it: health and care. A lot of people think that just the health solution will suffice. Caring, deeply caring about the individual, what they need, what they want, how they feel. It's an integral part of care.
Gutmann infuses every project, company, and invention of his with this philosophy, then builds a team with people who share the same value. Since healthcare deals with the most vulnerable populations, Gutmann says being attentive to detail is not just preferred, it's a core responsibility.
It's more than just creating a solution that is a utility or something that is fun or something that is, providing you some sort of, something that goes faster, easier, cheaper. Healthcare is related to our life, which is our most important asset. So there's a lot of responsibility to take when you build healthcare companies. So you need to think about regulatory, you need to think about privacy, you need to think about people and how they feel, right? So there's a whole slew of things that are above and beyond what you do with regular products and services that you need to be very, very diligent about.
Despite this extra responsibility, Gutmann says that too many people with good ideas don't get involved in the industry because they think it's too complex. And while there are challenges in this field that don't have to be dealt with in other businesses, Gutmann doesn't believe that these obstacles should discourage talented people from getting into healthcare.
There are some intricacies to take into account, but I think they're all manageable. With the right kind of talent, with the right kind of people, with the right kind of mindset, which I think is super important, it's possible to overcome. And then the opportunity is immense, both from a human perspective and from a mission and fulfillment perspective, but also from a business and financial perspective. The opportunities are humongous, right? So I think that thinking that it's impossible because it's healthcare, it's not the right kind of thinking. The right kind of thinking, maybe it's more intricate, but it's worth solving.
Especially in today's landscape, where AI is presenting unprecedented opportunities to push the field past its limits. Glover says she and other researchers have been waiting for this moment for years, when an idea comes along that completely rethinks the healthcare industry.
I recall my work 15, 20 years ago when we were asking ourselves, what's going to be the Spotify of healthcare? What will fundamentally change the landscape? And it's been 20 years. And while there have been some significant advancements, particularly in specific disease states, we have seen some significant changes. I think in terms of the payment structures, there has also been innovation, but I don't know if it has resulted in the utopian change that we all expected to see. And so I think with that being said, there are many, many scholars that are continuing to do this work. And to say, with all of the fantastic work healthcare entrepreneurs are doing, how do we get that innovation to the market sooner and faster? And so I am very hopeful for all of the healthcare economists and individuals that really focus on that space to continue to bring innovations to bear so that the clinical and technological side can actually reach the people.
You can find more information about Will Gina Glover, Ron Gutman, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.